Good day everyone, I am Christian, a Level 4 student nurse from Davao Oriental State University. Today, I will be presenting our topic entitled Breaking Myths, Building Trust, Addressing Hepatitis B Vaccine Misinformation. Before I begin, I want to highlight something important. When we talk about vaccines, especially in today's context, we are not only dealing with science, we are dealing with people's fears, beliefs, and experiences. And in the Philippines, where trust in vaccines has been affected by past events, misinformation does not just spread easily. It sticks. That is why this presentation is not just about explaining a vaccine, but about understanding why misinformation exists and how we, as future nurses, can respond to it effectively. To guide our discussion, our presentation is divided into four main parts. First, we will start with a brief but essential overview of the hepatitis B vaccine, including what it is, how it works, and why it is important. Second, we will present common misinformation claims that are currently circulating, especially within the Philippine context. Third, we will analyze what we call kernels of truth. These are the small pieces of accurate information that make misinformation sound believable. And finally, we will present evidence-based rebuttals, grounded in scientific studies and recommendations from organizations such as WHO, CDC, and the Department of Health. By the end of this presentation, we aim to achieve three main objectives. First, to clearly describe the hepatitis B vaccine in terms of its type, purpose, safety, and effectiveness. Second, to identify and understand common misinformation claims, particularly those encountered in our local setting. And third, to critically analyze these claims and respond to them using evidence-based reasoning, which is a key responsibility of nurses in promoting public health. Let us begin with the foundation. What exactly is the hepatitis B vaccine? The hepatitis B vaccine is designed to protect individuals from infection caused by the hepatitis B virus, which primarily targets the liver and can lead to both acute and chronic disease. What makes these vaccines particularly important is its type. It is a recombinant vaccine, meaning it is produced using genetic engineering. So instead of using a live or weakened virus, scientists isolate a specific component of the virus, the surface antigen, and then produce it in laboratory cells such as yeast. This means that the vaccine cannot cause infection, but it can still effectively stimulate the immune system to recognize and fight the virus. In terms of formulation, the vaccine is available as monovalent vaccine, which targets only hepatitis B, and a combination vaccine, such as the pentavalent vaccine, which protects against multiple diseases in a single injection. So this is especially useful in pediatric care as it reduces the number of injections needed. Now that we understand what the vaccine is, let's talk about why it is so important. The hepatitis vaccine is not just about preventing infection. It is about preventing serious, life-threatening complications. These include chronic hepatitis, liver cirrhosis, and hepatocellular carcinoma, also known as liver cancer. So one of the most critical roles of this vaccine is in preventing mother-to-child transmission, which occurs during childbirth. So this is particularly significant in countries like the Philippines, where hepatitis B remains highly prevalent. So without vaccination, an infant infected at birth has a very high chance of developing chronic infection, which can silently progress over many years. So, instead of waiting to treat complications later in life, the vaccines acts as a preventive intervention at the earliest possible stage, right at birth. This is why it is considered a cornerstone of public health programs worldwide. When we evaluate any vaccine, one of the most important questions is, does it really work? For the hepatitis B vaccine, the answer is clearly yes. Clinical studies have shown that the vaccine is over 95% effective in infants and children, and around 90 to 95% effective in healthy adults. But beyond effectiveness, what makes this vaccine remarkable is its long-term protection. Research shows that the immunity can last 20 to 30 years or even longer due to the development of immune memory. This means that even if antibody levels decrease over time, the immune system can still respond quickly when exposed to the virus. Because of this, booster doses are generally not required for healthy individuals, making the vaccine both sustainable and effective. Given all of this strong scientific evidence, one might expect universal acceptance of the vaccine. However, that is not the reality. Despite decades of proven safety and effectiveness, the hepatitis B vaccine continues to be surrounded by misinformation and doubt. This highlights an important reality in healthcare. Evidence alone is not always enough to change beliefs. That is why we now shift our focus to understanding these misconceptions. The first claim we will discuss is the belief that the hepatitis B vaccine causes autism in infants. This claim is widely circulated in social media, especially in parenting groups. In the Philippines, it gained more attention after the Dengvaxia controversy, which significantly reduced public trust in vaccination programs. Now, why do people believe this? There is a kernel of truth. Concerns about vaccine ingredients, particularly substances like mercury, have raised public questions in the past. However, this concern has been misinterpreted and generalized. Extensive research, including large-scale epidemiological studies, has consistently shown no causal link between vaccines and autism. Organizations such as the WHO and CDC strongly supports this conclusion. So while the concern may come from a place of wanting safety, the evidence clearly shows that this claim is not supported by science. The second claim is that newborns do not need the hepatitis B vaccine. This belief often comes from the idea that hepatitis B is only associated with adult behaviors such as sexual activity or drug use. While this is partially true, it does not represent the full picture. In reality, one of the most common modes of transmission, especially in high prevalence area, is mother-to-child transmission at birth. And this is where the risk becomes very serious. Infants infected at birth have an 85% to 90% chance of developing chronic hepatitis B, compared to only about 5 to 10% in adults. This means that the earlier the infection occurs, the higher the risk of developing long-term complications. That is why the World Health Organization and the Department of Health recommend administering the vaccine within 24 hours after birth, providing over 95% protection. So, rather than being unnecessary, the vaccine is actually most critical during the newborn stage. The third claim is that the vaccine contains harmful toxins that can damage the body. This concern became more widespread during the COVID-19 pandemic when general vaccine hesitancy increased. Now again, there is a kernel of truth. The vaccine does contain substances like aluminum and trace amounts of formaldehyde. But what is important to understand is that toxicity depends on dosage. The amount of aluminum in vaccines is extremely small and is used to enhance the immune response, making the vaccine more effective. In fact, infants are exposed to more aluminum through breast milk and formula than through vaccines. As for formaldehyde, it is actually a substance that the human body naturally produces as part of normal metabolism. The amount present in vaccine is far below harmful levels. So when viewed in proper context, these ingredients are safe and well regulated, supported by decades of global use. As we conclude, we can see that the misinformation about the hepatitis B vaccine follows a common pattern. It often starts with a small piece of truth, but that truth is taken out of context, exaggerated, and spread in a way that creates fear. As future nurses, our responsibility is not only to understand the science, but also to understand the patient's perspective. We must be able to listen, to empathize, and to respond with clear, accurate, and compassionate communication. Because at the end of the day, addressing misinformation is not just about correcting facts, it is about rebuilding trust. And that trust is essential in ensuring that life saving interventions like the Hepatitis B vaccine continue to protect individuals and communities. That would be all. Thank you.